And welcome back. Tom Hartman here with you, broadcasting live from the Families USA Health Action Conference. And Wendell Potter is here with us. Wendell Potter is the former executive with one of the big Cigna, one of the big health insurance companies, turned whistleblower. He's the author of Deadly Spin. He has a new ebook out. It's called Obamacare, What's in It for Me? And Wendell, it's always great to have you on the program.
Thanks a lot, Tom.
Thanks for joining us. Thanks for being with us. So, what's your take on the biggest issues of the day with regard to health care?
I think the biggest issues are that we've made some. I'll just be quite blunt. I think we've made some huge steps forward, particularly since the first of this year, in getting a lot of people covered. We've really made some enormous progress. I call it the end of the beginning of reform, though. There's so much more we've got to do, but we're going in the right direction. And we've seen that here in Washington, that efforts to roll it back have not worked. We'll continue to see efforts to try to thwart the progress and to make it a central political issue this year. But it's going to keep going forward, and I'm seeing a lot of effort, a lot of activity at the state level and the private sector too. So we're on the right road.
Mm-hmm. Well, yesterday we talked on the TV show, and I asked Senator Sanders about this. He was on it in the last hour. Vermont is going to a single-payer healthcare system in 2016 or 2017 if they can. I mean, they've legislatively pulled it off. And you said that you felt that there was, or you knew or believed that there might be some efforts to blow that up. Can you give me any details on that or any?
Yeah, I spent quite a bit of time up there. In fact, I'll be back up there next month talking to some of the folks who have been leaders in the effort to get Vermont to a single-payer system. The insurance industry hasn't been showing its hands, but I know how they operate. They don't want any state to go single-payer, even small Vermont, small liberal Vermont, because if it works, then other states will pay attention. And they'll emulate Vermont. It could Massachusetts could be next, or Oregon, or California, which has twice passed legislation to enact a single-payer system there. It happened to be during the Schwarzenegger years, and he vetoed those bills.
Which raises another question, and pardon my interrupting you, but why hasn't that come back up in California? And then we get back to Vermont.
I'll tell you why. Because the industry has some friends in the Democratic Party too. Even though there's a supermajority of Democrats in the California General Assembly, a lot of them are friendly to the Democrats. I mean,
so the industry didn't mind them passing it when they knew Schwarzenegger would veto it. But now that Jerry Brown is governor, they're not going to let them pass it.
That's exactly what's going on.
Wow.
That's exactly what's going on. The industry plays both sides of the street. They have their pockets or their hands with money in the pockets of Democrats as well as Republicans.
So in Vermont, how do you think that they're going to succeed?
In Vermont, I think there's a good chance that they can, but there will be an intense campaign to confuse people. One of the things that has to be done in Vermont, and this will happen really in 2015 more than this year, there has to be a debate on how do you pay for it? How do you transition to a single-payer system that is financed with tax payments rather than premiums? And so the challenge is going to be for the advocates to explain to Vermonters how this will actually cost less. Their taxes will be higher, but the overall cost of the program will be less because they won't have to pay premiums, nor will individuals and businesses have to pay premiums to private insurance companies. A lot of waste can be taken out of the system, but that's not so easy to explain. That's going to be a challenge.
Can it be done by a monthly or an annual fee? I believe it's 200 and I'm sure you know these numbers. What I've heard from listeners is that in Mexico you can get a minimal national health care system access for about less than $300 a year, and that in Canada it's about $150 to $250 a month.
Yeah, and the numbers will have to be communicated in that kind of way, so that it's perceived as being affordable and that it makes sense,
and that it's a fee rather than a tax.
And it's a fee rather than a tax, exactly. Yeah. But you can imagine that the industry will have all kinds of front groups in Vermont. It'll find every ally that it possibly can get to try to confuse people, and they'll be using the tax word day in and day out.
Yeah, your taxes are going to go up. Your taxes are going to go up. You taxed enough already.
Right. It'll be tax, and it'll be a loss of choice. They'll say that doctors will leave the state and businesses will leave the state. We saw the same thing. The same thing happened in Saskatchewan, the first Canadian province that enacted a single-payer system. It's a similar playbook. We'll see it enacted, and I'm going to be there to be a part of the battle.
Yeah. Well, they were not successful in Saskatchewan. Was that because they didn't throw enough money at it, or was it because this is really an idea whose time has come? And how, what lessons can Vermont learn from that?
Well, in Saskatchewan, it was a tribute to the forcefulness of the leader of the province, Tommy Douglas, who was a Baptist preacher, who was just he's often cited as the most revered figure in Canadian history, who was so very effective.
Kiefer Sutherland's grandfather.
His grandfather, is exactly right. And so sometimes it is just there needs to be a figure who is so dedicated to this, who personifies that kind of change and is able to rally support and just stay focused on it. And is a charismatic person to just keep going forward. We'll see if Peter Shumlin is up to the task, or somebody else emerges as someone who can get it over the finish line.
Right. What are the other issues that you're looking at? I know you're looking at dental care seriously.
Dental care is very, very important. When I said the Affordable Care Act is the end of the beginning of reform, there are a lot of things it doesn't do adequate justice to, and dental care is one of them. It doesn't bring enough people into coverage for dental care. We have about 150 million people who lack dental coverage. It's not a covered benefit under Medicare. The Medicaid program doesn't do a very good job because a lot of dentists don't take Medicaid patients. So we've got a big problem there. People don't realize, in many cases, the close connection between oral health and overall health.
Well, you can get a heart attack from gum disease, can't you?
You sure can. You absolutely can, and you can develop diabetes, and abscesses in your gums can lead to brain infections. There have been stories of right here in Washington, a young boy died not long ago.
Well, your mouth is part of your body.
It is.
Why isn't it covered? I don't get it.
And that is the weird thing. The mouth has been treated separately from the rest of our body for years because of the separation of professions, dentistry from the medical practice. That's something we've got to change.
That the dentists were never under the AMA.
That's right. They lobbied very hard to stay out of the Medicare program too, and they're not a part of the AMA. So that they've spent enormous amounts of money to stay separate. They don't really like insurance. They prefer cash-paying patients, and of course, the people who can do that are people who are, fairly well-to-do.
Right.
And
right. So therefore, basically, poor people don't have good access to dentistry.
That's exactly right.
How do other countries deal with that? Do you know?
A lot of countries have mid-level dental practitioners, sort of like nurse practitioners and physician assistants. In fact, 2 states in Alaska and Minnesota have begun allowing mid-levels to practice. The American Dental Association is opposed to it, but other states are looking at that. But at least 50 other countries are helping to solve the problem of access by allowing these mid-levels to practice, and they're making a big difference in preventive care, and doing some of the basic education work with people.
So they do stuff like teeth cleaning and basically simple oral stuff, and the complex stuff like tooth extractions or root canals and things. It takes a dentist.
It depends on the level of training, but absolutely that's correct. And it also allows dentists to practice at the top of their license, and that's which is a good thing.
Yeah, remarkable. Where do we go from? We have just a half a minute. Where do we go from here? What do we do? What's the pressure point? What should people do?
Well, the pressure point is, I think, to pressure the states that haven't expanded the Medicaid program to do that, and to also just make sure that people are aware of the benefits that are available to them, to sign up for coverage on the exchanges if they don't have insurance, just to keep educating people. That's why I wrote Obamacare, What's in It for Me, to make sure that people really understand what's in that law and what's in it for them.
Check out Wendell Potter's new book, Obamacare, What's in It for Me. It's a new ebook, so from all the usual suspects, I assume.
That's right, exactly.
Okay, great.